Amesh, I'm absolutely fascinated about what you've learned about the machinery of getting the vaccine out. Are we getting better at it?
We're definitely getting better at it, but we're not quite fast enough. This really has to be an effort that has no speed limit. And early on in December, it was very slow going with appointments, filling out paperwork, only scheduling a certain amount of people. And that's gotten better. And we are sort of hitting that million dose per day mark that people had been talking about. But we have to go much faster if we're going to stay ahead of these variants, stay ahead of this fast-spreading pandemic. And I think it really has to be kind of an all-hands-on-deck approach, using federal government assets like FEMA, the National Guard, to set up mass vaccination clinics. It can't be something that goes kind of at a pace where you have to kind of do this in a very managed manner. It has to be really assembly line. What we're seeing in the UAE, what we're seeing in Israel, that's the pace we need to be aiming for.
What will make the difference, Amish, on how quickly we can get there? I mean, again, we were looking at some of the stats. I mean, you know, world population, 7.8 billion. If you get herd immunity at 70%, that's a hell of a lot of vaccinations very quickly.
I think that the biggest difference is going to be, at least in the United States, is being able to actually find people to vaccinate and to actually give the shot, as well as find mass gathering locations where you can do this. So for example, a mass vaccination site at a stadium or at a convention center, and having people move through it in an assembly line and not really have all the delays. And a lot of that has to do with the predictability, because many states, many places don't know when they're going to get more vaccines. So they're very hesitant and cautious. They're not kind of going through this as if this is kind of, if they can expect to get more later. They're just kind of doing what they can do, and then they wait and they schedule more appointments. That pace can't happen. So I think we need to see a lot more predictability and visibility into the supply chain and when it's coming. And that, I think, will probably give a lot of states a lot more confidence when they set up these appointments.
Are there definitely enough vaccines to go around in the U.S. right now?
Well, right now, I think we're worried about the supply chain more in the medium to longer term, because we've got companies like Moderna and Pfizer that have contracts with Operation Warp Speed, so they are increasing their production capacity. But what the biggest problem is now is that many states can't even take the vaccines that they have in their freezers and put them into people's arms. So if you look at states, maybe with the exception of West Virginia, North Dakota, you have a lot of states that have the majority of their vaccines still sitting in freezers. And I think that can't be the issue anymore. We can't have vaccines in the freezer, and that might be because they're worried about second doses. They don't have enough people to do this. All of that really needs to evaporate as quickly as possible, and there should be no vaccine left in the freezer. And I think that has to do with logistics, and it has to do with states having support from the federal government for the resources to actually turn these vaccines into vaccinations.
Once that happens, first of all, how quickly do you think that happens with, a new government in charge, with a new administration in charge? And even if you get through that, what's the percentage of the population of the U.S. being vaccinated?
So I do think this is picking up, and it was picking up at the end of the Trump administration, and it continues to pick up under the Biden administration, and they've made it a major priority to fix this problem. I do think it's going to be sometime before we hit the herd immunity threshold, probably in summer. But remember, we will get benefits from the vaccine before that, because the vaccine priority groups and the rollout has been designed not necessarily to stop spread, but to stop death and to stop hospitalizations. That's why nursing home residents, community dwelling elderly individuals, those with high-risk conditions, those are the people that are first, and they make up the bulk, if not and clearly the majority of people who are getting hospitalized and die. So I think once you get that group vaccinated, and we're already starting to see benefits like that in places like Israel, you will start to see hospital levels go down. You'll start to see deaths go down. Cases are still going to spread. This isn't going to go away. Even after people hit herd immunity, COVID is still going to be a disease, but it won't be a public health emergency, and the spread will be much more controlled, because we won't be worrying about it landing on a vulnerable person, which then puts them in the hospital and then they die. So I think we will see benefits probably as we get into spring in terms of hospitalizations and deaths, and I think that will be something to celebrate.